thank you for allowing me to serve as ASLMS President for the coming year. It is a great honor and privilege, a high point of my career. I'm very, very grateful to you for this. I also realize that leading ASLMS is a responsibility, one that comes with challenges, and that you have hired me for a year to do a very specific job. I promise I will do my very best. Many of you are much wiser than me, much more experienced, more skilled at using lasers to treat patients, and more distinguished as scientists and innovators. We have such a broad range of skills and expertise within our membership, spanning so many professions and specialties. Please do be aware that the ASLMS board, staff, and I are very interested in what you think about what our society is doing, and in particular, how we could do better, innovate, and grow. Please do not hesitate to share your ideas for the society, whether in person, by email, by phone, otherwise. Everything you share with me will be shared without attribution, if you so prefer, with the board and considered during the strategic planning process that will soon be initiated. We did this last a number of years ago, and it's time to start again. I also wanted to take the next few minutes, very few minutes, to review some of what we are planning for this coming year. Needless to say, our society will continue to support our current educational, research, and advocacy work. Everything we're doing well, we'll continue to do. In addition, we would like to introduce some new initiatives. One of these, as Paul mentioned already, is to focus on issues pertaining to patients with skin of color. As we all know, the US population is increasingly mirroring the diversity of the world at large, and we need to be able to provide excellent care for patients of all ethnicities and races. We will, to this end, be surveying our members, patient groups, and industry partners to better understand the challenges of educating prospective patients of color so they know of the many services our members can offer them. We also want to improve our members' ability to safely and effectively treat patients of color. Growing this market will help our clinician members, our industry members, and most of all our patients who will benefit from our skills and expertise. Another area we are planning to expand is collaborative clinical research among ASLMS members. The Society, of course, continues to fund major research initiatives, as we saw, through grants. Moreover, our individual members lead innovation and device development, as we saw in the previous session in this room, and our industry partners excel at refining and commercializing cutting-edge technologies for patient care. We already do a lot in this space. All of these initiatives, all of these current activities will remain and continue to be nurtured. In addition to these existing programs, there's a potential to further grow our research footprint by engaging many more of our members in collaborative clinical research, such as retrospective and prospective cohort studies and ongoing registries, so all the information regarding the volume of patients we treat can serve a common good. The studies that come out of this research will demonstrate the value of lasers and energy devices, grow the market for our industry partners, bring credit to the society, and above all, engage all of our own members. Participation in these initiatives will be open to all members. A related initiative is guidelines development. As you saw, we've already started this process with guidelines pertaining to vascular malformations and lesions. Many professional societies develop clinical practice guidelines and other health guidelines in their area of expertise. These are useful for patients and providers and for industry in that they encourage and facilitate good practice. By committing to produce clinical practice guidelines at the highest levels, ASLMS will also increase its external recognition as the leader in the clinical applications of lasers and energy devices. While much of my career has been in academics, I do realize the vital interplay between our healthcare provider and scientist members and our industry members and partners. This alliance between clinical medicine and industry is vital to the ongoing health, growth, and success of our society. We are now re-envisioning our collaborations with industry so that ASLMS can provide industry with more tangible deliverables, and industry, in turn, can further support the educational and research missions of ASLMS. We will be calling on you, those of our industry partners who might be in the room, and you, our clinical members who frequently collaborate with industry, to assist us in advancing this work. Membership growth and diversity, as you heard in Paul's speech, remain a primary objective of the ASLMS board. We need your help in growing the society. We need your help in identifying new members, whether they be scientists or doctors or nurses, trainees or students, or those well-established in their careers as clinicians or researchers. Please help the society this year by committing to not only renewing your own membership, but inspiring at least one other member to join. Finally, I would like to end by thanking our meeting chairs for this year, Catherine DeGiorgio and Omar Ibrahimi, for their outstanding work in developing the phenomenal program from which we have all benefited. As you heard, they have been creative and tireless, meeting every week for over a year, for several hours each week, to make it all happen. I would also like to recognize the meeting chairs for next year, Shlomit Halakmi, Jessica Labadie, Yakir Levine, and Ariel Kovar. They will be interested in your thoughts and feedback as they develop next year's program. In conclusion, I understand that I, the board, and the ASLMS staff all work for you. Our vibrant, inventive, collaborative, brilliant, and innovative members are what makes the society exceptional. I look forward to working for you in the coming year. Thank you for all that you do.